All right, well, welcome everyone to the second webinar in our Farm Stress series. I am Lorna Wounded Head, and I am the Family Resource Management Field Specialist, and I serve on the Rural Behavioral Health team. My main location is at the Sioux Falls Regional Center. Joining me today is Olivia Amundson, and I'll let you introduce yourself.
Yep. Hello, my name is Olivia Amundson, and I am actually one of the cow-calf field extension specialists. I am also out of the Sioux Falls regional office, and I also serve on the Rural Behavioral Health committee as well. So I look forward to talking to you a little bit about managing mental health and coping with stress.
All right, thank you. We're going to get started today. We do have a polling question because we're interested in learning who is here today. So that question, you should be able to see that on your screen now. And go ahead and respond to that question. We'll give everybody we'll give it about maybe 30 to 60 seconds. Matt, you can monitor to see how many people have completed survey question. All right, go ahead and stop the survey. Thank you. You're on it. So we have a majority of community members, but kind of a good mix of community and then individuals who work with farmers and ranchers. So good. So that helps me to kind of know maybe specifically what approach to take with our session today. So thank you for that. So to get started, as we're talking about managing mental health today, for farmers and ranchers and anyone who works in ag-related industry, uncertainty is chronic. It's kind of one of the things that we can guarantee, that the weather, the markets and prices, the national economy and international trade issues all contribute to that uncertainty. And for anyone who is a planner and likes to know what to expect as you plan out your season or your year, it's sometimes difficult to do our planning because of those uncertainties. Our hope is that for when we have down times, that there are then an uptime so that it somewhat balances out. And so maybe we can recover a little bit when things haven't gone so well. It's important to remember that everyone reacts to uncertainty in different ways. And in the long term, that uncertainty can begin to cause some mental health challenges. And that's why we're doing this webinar today, to talk about managing our mental health. We're going to share some information about recognizing the signs and symptoms of stress, anxiety, and depression. These are mental health issues that impact 1 in 5 adults every year. If these symptoms are managed, they can be short-lived. But if they're not managed, the symptoms can lead to much more severe issues. And as we cover this information today, we want you to not only think about your personal mental health, but also the health of those you are interacting with, such as family, friends, and maybe the clients that you work with. Having a relationship with someone, you'll notice the changes in their appearance, behavior, and actions, which could indicate that they are experiencing a mental health challenge. So I'm going to start out by talking about stress. And stress is defined as it's a need or a demand that people confront that is perceived as burdensome or threatening, and that can lead to physical or mental health problems. And not all stress is bad. When we are excited about something such as a wedding, birth of a baby, holiday, graduation is something that a lot of us participated in the last couple of weeks. We feel that anticipation. And this helps us to mentally and physically get ready for the event. And this is the type of stress that's called eustress. It energizes us, and it's what keeps us going through, say, seeding or harvesting. Eustress also maybe kind of like it energizes you and it motivates you to maybe tackle that to-do list or to get things done. However, when we suffer from too much stress, and particularly if it's over a longer period of time, this is called distress. Prolonged distress can result in severe physical problems, emotional problems, or both. And in many rural areas, a high percentage of visits to family physicians are due to stress-related illnesses. So individuals may not be going to the doctor because of symptoms of stress, but they're being checked because of maybe weight gain or severe weight loss or headaches or stomach aches or some other issues like that.
All right, so when we think about signs and symptoms of stress, Lorna kind of went through some of them, but we have to understand that, stress is a feeling, and we all experience some sort of stress in our lives, especially when we're feeling challenged or overwhelmed. And like Lorna mentioned, we have good stress and we have bad stress, and good stress is really good. It really helps us, if we think about maybe completing a project for work or maybe studying for a test, it really helps us to accomplish those things that we need to get done. However, stress can become chronic, and that's when it gets detrimental to our overall health. And so stress is really more than just an emotion, and it is a hardwired response that just travels through our whole body and affects every cell within our body, and really can actually either be advantageous, especially in the short term. But if we think about chronic stress, can be really disadvantageous and can be actually extremely detrimental to our overall health. And so what chronic stress is going to do is, if it's activated for too long, it really affects that primitive response of fight or flight within our body. And it also changes the response in our brain. So if we think about how, stress in general, so when we know, I think we've all heard that when we're stressed out, our cortisol levels are high. Well, that's a true statement. And our adrenal glands, which are above our kidneys, actually release this cortisol. So during fight or flight or stressful situations, we have this release of cortisol. And during a fight or flight situation, this can be beneficial. So if we're running away from a bear, these are good things. But when we think about stress in relation to our everyday tasks and work, this can be extremely detrimental, because what this cortisol is going to do is it's going to affect portions of our body. So for example, our heart, it'll cause an increase in our heart rate. It could cause high blood pressure. It can also cause a retention of fat, and can cause buildup within our arteries, which can eventually lead to, more detrimental things such as a heart attack or stroke. So understanding that chronic stress is detrimental is extremely important. But it also works within our brain-gut interaction. So our brain essentially senses that we're stressed, and then it's going to activate this autonomic nervous system, which then goes through a network of nervous system areas that then goes to our gut. So if we're getting these feelings of maybe butterflies, or even actually having symptoms of constipation or IBS, can all be some of those physical symptoms of chronic stress. So like we have here on the slide, if we notice an individual or maybe even ourselves having maybe chronic headaches, again, that upset stomach or nausea, again, going back to that brain gut health, backaches, that high blood pressure, high blood sugar, or a racing heart, can all be indicators of chronic stress. Now, I understand that a lot of these, we can't necessarily see, but if we hear somebody maybe complaining that they've been having headaches or backaches or maybe an upset stomach or getting nauseous, these could really be some of those first indications that somebody is experiencing high levels of stress. It can also affect us on a mental standpoint. So anxiety and stress really go hand in hand or go really well together. So if we're experiencing a lot of stress, a lot of times we're going to see some anxiety tied to that. It also will change our mood in the fact that we may become maybe angrier or sadder. We could also become depressed or hopeless. And it also can make us irritable. So if we're noticing somebody who maybe is short-tempered and hasn't always been short-tempered, this can be a really good indication, again, that those stress levels are getting to an unhealthy level. And then we have some behavioral signs and symptoms. So these would be things like not being able to sleep or sleeping too much, not eating or overeating, and then using substances to kind of deal with some of those stressful situations. So cigarettes, drugs, and alcohol. So again, either noticing in yourself or other individuals that their alcohol consumption is increasing, or they've now stumbled upon some sort of drug, is all big indicators that stress is becoming too much. Again, yelling and screaming, that irritability factor, and then withdrawing. This will be another big indication that an individual may be becoming too stressed. They start to isolate from, their family and friends. They're not going to some of those, social events that they used to in the past. These can really be some of those areas that we, as individuals, can be paying attention to help individuals who may be experiencing chronic symptoms of stress.
All right, so depression is a common and serious medical illness that negatively affects how people feel, the way they think, and then the way that they act. Symptoms will vary, and the way it affects people's lives will be different depending on how severe the symptoms are. So as we go through the signs and symptoms of depression, one thing I want to stress is that we may feel some of these signs and symptoms every once in a while, and maybe even for a couple of days. It could be related to those distressful situations that we are going through, or some of the events that are happening in our lives. Some of these symptoms that we're going to talk about might actually just be common behaviors of an individual that you know. And so that wouldn't necessarily raise a red flag for an individual. As we talk about these different mental health challenges and the signs and symptoms, keep in mind that for individuals that you know, if you see a change in their physical appearance, their mental health, or in their behavior, and you see that over a period of time, that's when we want to be able to step in and intervene and maybe ask to provide that support. So with depression, some of these symptoms are similar to stress, and as Olivia just said, depression is a sign of stress. For individuals who maybe are tired easily, more easily than usual, where they're they lack their energy, could have a weight loss or a weight gain, maybe headaches or unexplained aches and pains. This could be a sign of the depression. If you're hearing them use a little bit more self-criticism and blame, where they're expressing some worry about different situations, if their outlook seems a lot more negative, and you see them not being able to concentrate, or there's that hopeless and helpless thinking, this is an indication that they may be experiencing depression. And as with stress, if they're withdrawing, neglecting some responsibilities, losing interest, more emotional than usual, or show very little emotion when it would seem like there should be emotion shown, and sadness and agitation, these are all indications that someone might be expressing or experiencing depression. Depression is treatable, and between 80 and 90% of individuals who have symptoms of depression are able to get relief with a proper and timely intervention. The sooner the symptoms are treated, the better the chance of recovery. Individuals may experience any of these signs and symptoms for a short period of time, as I already mentioned, but it's when the symptoms persist that is when seeking help is important. And if for someone who is, if you're noticing these signs and symptoms in family members or coworkers or clients or friends, it's important to try to talk to the individual and find out how they're feeling, what they're experiencing, find out, do they feel that they might need to get some type of professional assistance, and then provide them with that support to help them find the help that they need. And as I said, it could be something that maybe with just some self-help strategies, such as exercising or taking some time away from work, or just spending time with family members. That might be the thing that's needed in this case. But as always, seeking out that professional help is going to be the best way to get the assistance that's needed.
All right, so along the lines of stress and depression, another mental health illness that we see along with some of these are anxiety. So, anxiety definitely doesn't discriminate. This really can happen to anybody. And anxiety and stress really go hand in hand in a way. And like a little bit of stress can be good for us, so can a little bit of anxiety, because if we are anxious about certain things to get things done, it just helps us move forward with maybe a work project or things like that. So like stress, a little bit of anxiety can be a good thing. However, when we start experiencing large amount of anxiety, that's then causing changes in our physical, mental, and behavioral health, that's when things become a lot more serious and we need to start taking action for these things that are going on. And so when we think about anxiety really is mostly caused by some of those perceived threats within our environment, no matter, what they are, whether it's, the price of cattle or the price of corn, like those are all threatening situations for farmers and producers, because these are things that affect their everyday daily living. And some people are more likely than others to experience severe symptoms or signs of anxiety than others. And it does go back to some of those self-care actions that we're willing to take. But if we think about anxiety on a physical standpoint, some of those signs and symptoms, they go back to being restless, or being having some tension or that inability to relax, really, not being able to sit down, maybe constantly thinking about things. We've got that increased heart rate again, shortness of breath and rapid breathing. We could see sweating. Maybe they're complaining of some dizziness or numbness, as well as trembling or shaking. And I think as individuals who are working with maybe producers, it's important to understand that the signs and symptoms of anxiety are very similar to other health-related issues. So if you see somebody who's experiencing, they say their heart is racing, or they feel short of breath, they are getting sweaty, maybe they feel dizzy, maybe they're having numbness in areas of their body, but they know that they're having a panic attack, then we know that we can do the appropriate things for that person, like sitting with them, helping them breathe through the situation during that situation. However, if we're working with an individual who's never experienced a panic attack and they're not familiar with some of these signs and symptoms, it's important that we get the appropriate help that's needed, because a lot of these signs and symptoms are exactly the same as those of a heart attack. So again, paying attention, asking that individual, if they've ever had a panic attack, is important when assessing this situation. So if we need to get the appropriate medical help, we can. When we think about some of those mental signs and symptoms, again, that mind racing or going blank. So if you're anxious and you can't sit still, it might be because your mind is racing and you're trying to think of, what's the next scenario or what's going to happen next, or you just completely blank out the situation in general. Decreased concentration or memory. I think this is another good example of producers within the industry. If they are having, a hard time concentrating, or they can't exactly remember what you told them, the week before, this could again be a very good indication that they're experiencing some sort of maybe anxiety or stress. Indecisiveness is another one, unable to make maybe some of those bigger decisions just due to fear of the unknown, or just because of that decreased concentration or memory. And then confusion. So if we're seeing some of these things on a mental standpoint, it's important to make sure we're working with those individuals to pay attention if things start getting a little more serious. And then behavioral. So this kind of goes back to that stress sign and symptoms, but avoiding situations. So there are different aspects of anxiety, and there's different phobias. So if we know an individual who's usually been very social or has gone out to social events, then all of a sudden they're staying home, they don't want to go see family, they don't want to go see friends, this could be a good indication of anxiety. Obsessive or compulsive behaviors are another big one. So this would be something like an individual, we always think about an individual who's maybe washing their hands multiple times. And I guess for an actual example, I worked with an individual when I was a psych nurse. Her room was at the end of the hall, and just due to some discharges, she got her room moved closer to the nurse's station. However, she did deal with obsessive compulsive disorders. And so every night as she would go to her room, she had to walk all the way to the end of the hall and then back, so making the trip longer than it needed to be. But because of that obsessive compulsive disorder, she had to follow that routine. So if we're seeing strange things like this in individuals, that may be another good sign that they're dealing with something a little deeper than what they may be expressing. That distress in social situations, again, some of that phobia of being around people, increasing the use of drugs and alcohol. This is very similar, again, to that of a stress response. And then again, just avoiding people or situations.
All right, as I mentioned previously, self-care is an important part of managing our mental health. And ideally, we want to have a balanced overall wellness. And when we're experiencing a mental health challenge, the cause may be another aspect of wellness, such as a financial issue or environmental, because all of the dimensions of wellness are interconnected. So if I'm stressed out about my finances, maybe income isn't coming in as I need it to be in order to be able to cover all of the bills that I have, and that might be impacting my my emotional behavior, and I might be agitated and angry and short with individuals, and I'm just kind of thrown out of focus, and maybe then I'm not thinking in terms of trying to problem solve and figure out ways to maybe deal with the situation and be able to make some healthy decisions. Focusing on self-care means accepting what we have control over and what we do not have control of. For farmers and ranchers, the weather and the markets are things that we cannot control, but we can control our reaction and our response to those situations. If you or someone close to you is experiencing a mental health issue, reflect on what might be the cause and which dimension of wellness might be out of balance. And this isn't always the case and isn't necessarily always the solution to any mental health challenges that individuals are experiencing, but it's maybe a place to start and maybe a place to figure out, what else do I need to have? So here are a few suggestions for ways to manage each dimension of wellness. So whether this is something that you can incorporate in your life in order to maybe balance things out a little bit better, or if you have friends and family members who you can maybe make some suggestions to about helping them to improve their wellness. But first, from the emotional dimension, some ways to manage the emotional wellness are to recognize the stress, to acknowledge that this situation is very stressful, and to ask for help if needed, and most importantly, to get enough sleep so that we're more rested. I am experiencing kind of a stressful situation right now as my family and I are moving. And so all of the things that are involved in that process, there's always kind of a list of things that has to happen, and item A has to happen before we can get to item 2. And if those things don't line up, it can be very stressful. So one thing that I always try to do is just think about why am I feeling this way? Why do I want to yell and shout and maybe throw things? And it's because of the situation. And so just give myself a chance to kind of settle down a little bit. In terms of our social wellness, I think you've probably heard this quite a bit, but with the COVID pandemic, our social interactions have changed quite a bit in the last year. For some people, it's that method of socializing with others and not being able to be around other people, or feeling anxiety being around other people and in large groups. And so in some cases, people may become a little bit more introverted, or not willing to go and meet other people or go to the places that they usually went to. So for example, in small communities, a favorite place to gather is at the cafe for coffee. And if you're noticing that once the cafe has opened up again, so people can go there, if you're noticing that there's certain people that you haven't seen for a long period of time, reach out to those individuals to see if they're doing okay, to find out what's happening, and just to be able to, connect with them. And as I mentioned already, with financial wellness, that can cause a lot of stress. COVID has become a financial crisis along with a health crisis. And what's always important is to view your financial situation. So I do personal finance programming. And the first thing I always tell people to do when they're concerned about their finances is to track their spending, look at what their income is, what is their expenses, and look at, where there might be a problem. Is there a little too much debt to deal with on a monthly basis? Has income decreased? Are health benefits being impacted? All those types of things. And it's easy to try to ignore our finances and just kind of go about our business, but it's a lot healthier to address the situation, even if it's not going to be a fun thing to look at. But if we know we have all of our information, then we can make some decisions about it and to seek out the type of help that we will need in order to deal with the issue. In terms of intellectual or academic wellness, um, these are some things that some things in this area are great ways just to alleviate stress. So being able to engage in some creative activities, reading a book, viewing a webinar, talking to professionals in your industry to learn about new approaches or trends are great ways to help reduce stress, but also maybe ways to get us connected socially, to get us inspired or invigorated about trying something different, and to be able to implement some of the ideas in order to help solve some problems. In terms of our environment, I'm thinking about like kind of the space that you spend your time. And once again, because of COVID, if you've been limited in maybe the space that you've been able to be in, if you live on a farm or a ranch, to me that would be very inspiring so that I could be outside a lot. But for those of you who maybe are confined to an office space or something that doesn't have a lot of interactivity with other people, you want to look at that space that you are in most of the time. Is it cleaned? Is there a need for maybe some decluttering? Is there if you're on a farm or a ranch, is there a need to maybe clean out a barn or a shed, or to kind of work on those repairs that need to be done? Focusing on taking care of your space is really important. I have the type of personality that when I'm stressed, in order to calm down, I need to have a clean space. And often cleaning and organizing things helps me to reduce some of the stress I might be feeling. And it also helps me to be able to kind of quickly see results. So if I'm sitting in my office and my desk is piled high with papers, if I can just take a few minutes to organize that and get things straightened out, that helps to reduce my stress and anxiety, and helps me then to focus on the next task at hand. Another aspect of our wellness is our spiritual life. And in terms of spirituality, there's a lot of things that we each do individually to manage our spiritual wellness. And if it is spending time in meditation or spending time in prayer, or attending a service with other people, or visiting with someone who can provide you some spiritual guidance. Always try to think about, reflect on your values and your spiritual life. And many times we kind of shove that aside when we're stressed out, when that is the aspect that can help to reduce our stress and anxiety. And then the last dimension of wellness is physical. And we've given some examples of how depression and stress and anxiety can impact our physical health. And taking care of yourself is really important. So if you haven't for a long time, have your annual checkup, and just talk to the medical professional that you're meeting with about how you're feeling, what you've been experiencing. And other things you can do is to incorporate daily intentional exercise. And it doesn't have to be real extensive or intensive in terms of that physical activity, but maybe just take a walk around the section, or go outside and weed in the garden for a little bit, or just take some time to go for a walk with some friends or some family members, or do some yoga or some meditation. And these are the types of things that can help, if you do them every day, or on a regular basis for 20 to 30 minutes, it can make a big difference in your outlook on life. And it can kind of clear your mind in order to look at some of those problems that might be causing some of that stress and anxiety. If self-care approaches are not providing that relief from the depression, stress, or anxiety symptoms, then it's important to be able to seek out some professional care. And it might be important for you to have that professional care along with some self-care activities.
So really, what can we do to help, our friends and family that we feel may be experiencing some sort of a mental health issue? And, I think it's important to remember that we're not going to be that person. Well, it's not our job to necessarily fix that situation, but we can really be that first line of defense for getting this person the help that they need before things get too out of hand. But the first thing that I think is important is that you assess your own personal health first. So we need to understand if we're feeling some sort of level of stress, and then being able to recognize, maybe what's causing it. Is our level of stress being caused because we're focusing so much on the stress level of, our loved ones, or is it based off of, maybe our own situation, things maybe at work, or we are also paying attention to, maybe our financial situation, or we're paying attention to the weather, as well as our loved one. So ensuring that we are also healthy is important when we think about how we're going about helping, that friend or family that's also experiencing stress. And then also thinking about, how are we dealing with our own stress? So Lorna just went through a lot of, self-care ideas and advice to kind of work through, dealing with stress, anxiety, and depression. And I think it's also important to note that too much of a good thing can be detrimental too. So, thinking about exercise, I'm guilty of this in my own life. But during a stressful time in my life, I used exercise as a coping mechanism. And while it definitely helped, it almost became unhealthy. So like individuals who maybe, binge eat or don't eat, somebody who exercises can over-exercise as well. So it's also important to just recognize some of maybe these signs and symptoms in ourselves before we try to help another individual with their mental health issue. When we think about approaching these people, it's really important to approach them with open-ended questions. We don't want to just say, hey, are you doing okay? Leaving them with the opportunity to be like, yep, short, quick answers that don't really address the actual situation. So coming at that person and really, starting to have a conversation with them and saying things like, I'm concerned about you, or, lately I've noticed that you've been withdrawing from, friends and family, or maybe you've been having more beers at night than usual. Things like that are really going to start that conversation to allow that person to hopefully open up to you and discuss maybe what they're going through. Like I said, we're not here to fix their problem, and we're not here to be their therapist. So it's important that we use our resources that are available to get them the appropriate help that they need. And so to start out, it might be going to see, their primary doctor to just kind of get those first steps moving. Or it could be a situation where you go see a psychiatrist or a psychologist so that they're able to kind of talk through some of those things that are bothering them. Counselors are also another great resource, somebody that can really listen in a non-biased manner and hopefully give advice moving forward for that individual. Some people will look to, their local church or clergy for some of that, again, like Lorna said, that spiritual self-care. But there's also individuals there that, work alongside people that are experiencing maybe a mental health situation that can maybe be the first step to getting better, or maybe the first step in getting the right help that individual needs. So these are some examples of resources that are available within the community. Within the next few slides, we'll give examples of, some helplines, hotlines, things that are available to use that people can also rely on if they're not exactly sure where to go with a certain situation.
All All right, now that we have shared with you some signs and symptoms to look for, maybe in yourself, but also in friends and family and friends and family members, coworkers, and clients that you deal with on a regular basis, we want to leave you with some ways that can help you to take some action. Both Olivia and I are adult mental health first aid facilitators. Adult or mental health first aid is a training course that teaches you how to provide support for someone who is experiencing a mental health challenge. Just like you become, like if you take a CPR course and you learn and become certified in first aid, you are someone who provides that support when someone is experiencing a physical challenge or an injury of some sort. Mental health first aiders are help, or through that process you learn, what to look for, but most importantly how to respond to someone who is experiencing a challenge. This course is it's about a 6-hour course. It's right now through SDSU Extension, we're offering the courses virtually. We have a course, an adult mental health first aid course scheduled for June 29th. And we'd like to invite you to register and take this course. The virtual portion where you're working with the mental health first aid facilitator is about a 6-hour time period. And prior to the virtual training, there is some online pre-work that everyone does to kind of learn some information before we get into the training. So it is kind of a time-intensive training, but once you complete the training, you then are a mental health first aider. And so that you have developed those skills and the knowledge in order to provide assistance to someone. So registration is open for this course on the June 29th. The registration fee is $30, but if you would like to, we're inviting you to register today for free. And when you register, you just need to use the code AMHFA. Rather than paying the $30, there's a place for you to enter that code so that that's no cost to you. To register, if you go to our extension website, which is extension.sdstate.edu, and then in the upper right-hand corner of the page, you'll see, just click on events, and then you'll find, scroll through the events that are available. This is a great opportunity for you to develop your skills and then to provide that support to individuals that you work with.
All right, so like I mentioned previously, some other resources that are out there that you can utilize, and if you feel like you have a friend or family member that may be dealing with chronic stress, anxiety, depression, and you're just not really sure where to go. SDSU Extension does have a resource there. You can see that link. Go ahead and follow that link, and that will give you additional resources as to where to go. There's also the Farm and Rural Stress Hotline. This is a free confidential hotline that is available 24/7. It is through Avera Behavioral Health, and you get to you call that number and you're able to talk to an individual about the situation, and they kind of help decide whether or not a greater in-depth assessment is needed. And then there's the National Suicide Prevention Lifeline. This is another important phone number to have even saved in your phone. This is a line that you can call for yourself or for individuals if you're just uncertain of what to do in a certain situation. But these are all good resources to have kind of in your back pocket when we think about helping individuals that may be dealing with stress or anxiety. So that's the end of this presentation. We do have 2 additional polling questions. And I'll let those pop up here. All right, so if you can answer these two polling questions, and then we will end this presentation.
If you have questions or want to get some more information, both my email and Olivia's email are posted on the screen right now. And if anyone has any questions, you can enter those into the chat box. Thank you for that. I'm going to stop sharing and see if there's any questions in the chat. I'm not seeing any, so I just want to thank all of you for being here today. Let's see if I have the right. Yeah, I stopped sharing, so sorry. Thank you all for being here today, and please reach out to any of us if you have any questions or want more information about mental health first aid training. And look at our on the extension website for more webinars in our farm stress series. We'll be doing these throughout the summer.